Yes, again start this session. Humerus. We are talking about the humerus and femur. The anatomical, some form of get idea about the anatomical area in the femur and the humerus. Now we are going to discuss the some form of innervation of the nerve supply of the femur and humerus. Femur nerve supply consider nerve innervation. The lumbar sacral area give the nerve innervation of the femur bone. Femur head and femur shaft give the nerve of femoral nerve, some branch of femoral nerve. Head also give the some branch of obturator nerve also. Consider the humerus bone. The mainly give the brachial plexus. Brachial plexus give the axillary nerve. Axillary nerve innervated the full bone of the humerus. Then we are going to talk about the blood circulation. Then we are going to the circulation of the humerus and femur. Mainly brachial artery give the circulation supply to the humerus. Brachial artery give the blood supply of the humerus. Femoral artery give the blood supply of the femur. Brachial artery considered in the two area. Circumference artery give the blood circulation to the humerus bone. Nerve supply, axial nerve, femoral nerve. Blood circulation of the humerus head, circumference artery. Circumference artery, posterior circumference artery and anterior circumference artery. Brachial artery give the some form of branch. Femoral head give the some form of branch. Femoral artery, lateral circumference femoral artery, medial circumference femoral artery. lateral and medial circumference femoral artery. Now supply of the femoral nerve or some form of obturator nerve, some little bit connection. Axillary nerve give the humerus bone. It is innervated some form of small branch go and divide and go down directly inside the bone, some form of small arterial supply. So because of the some form of fracture correction is the most important. This circulation, calc formation, and hemostasis, callus formation, and correction or see these two bodies most important. This circulation and nerve supply. Right now, we conclude the femoral and humerus arterial supply. Then we are going to the some form of small point. This is the head. Connect the glenoid cavity. That we consider the connection of this glenoid cavity and humerus head. This is also the femoral head and acetabulum. The pelvis bone, some form of lateral area. There are some form of fossa. Connect these two head. Most important to identify what is the most important area. Humerus head connect lot of the glenoid cavity, not the proper connection. It is connect the one third of connection in the glenoid cavity. This is the handle like connection. But femoral is go to the pelvic bone. There are some form of fossa connect inside the acetabulum, like two-third like. Some form of isthmus is small. The fovea, some form of tendon also the connect. And the glenoid cavity, humerus head, acetabulum cavity, humerus head, lot of connection, the ligament, a round connection with the ligament, and a round connection with the synovial membrane, and a round connection with the fibrous membrane. They are preparing gradually and covering the capsule. We are getting some good idea about this covering of capsule. This is the synovial joint, and this is the membrane and covering to the hyaline cartilage. These two are ball and socket joint, can mobile the vast area, the several coronal, sagittal, transverse and rotatory area, medial rotation and lateral rotation, lot of rotatory area, freely mobile area. We can get proper idea about this with the gather movement also, and we can explain this thing. The plan also they can explain, right? Okay, now discuss the covering of the this head and around area. Then we are going to do some form of special thing about this two ball. This head and this long bone are freely movable. Why I am talking this freely movable? When we are ambulating, when we are walking, when we are running, when we are jumping, and this head and this shaft are always mobile. This is the weight bearing full strength bone of the body. Then we are going to the upper limb, humerus bone. When we are considered the flying bird, flying bird, like a bird flying on the air, these birds having some form of movement of the feather. Why we are consider this? This is gradually modify the arm. The arm also the freely mobile around area we can move the some form of lot of plan and spaces and freely mobile area. Consider the humerus bone. It is connect the scapula. Scapula also the flat bone, but we can see the scapula bone not connect properly the skeletal another bone. That is the most important point. Scapula not proper connect to another bone. It's only clavicle connection. It is only clavicle connection. We can see the acromion process. Acromion process, clavicle connection. Only it is the connection. This connection is only the body-body connection. The all other scapula bone connect with the muscle attachment of the skeletal system. That is the most important point. I am going to emphasize this point. Why we are talking this point? The arm also, the humerus also, the other lower part of the arm and hand also, the not proper connection of the body. It's can freely mobile of the air. That is the main purpose things I am going to emphasize. Now we discuss another things, another program. This is conclude today explanation. Okay, thank you.